Good morning. The committee will come to order. Welcome and thank all of y'all for joining us today for the full committee hearing on veteran suicide prevention. Most of us have heard VA's staggering and heartbreaking statistic that every day 20 veterans end their lives. 20. We also know that over the past several years, VA has invested significant resources toward addressing that number, which is stubbornly themselves. I hope to hear more about the various programs and initiatives VA mentions in its testimony, such as those for women and homeless veterans. I'm also eager to hear about how these programs and initiatives partner with communities and organizations that also are working hard to be a part of the solution. I also want to know how these initiatives are truly executed. It's nice to outline how a program should work, but for every veteran who is not properly referred for treatment, for every veteran who is not admitted due to a shortage of a staff or bed, or for every veteran who feels that they've been ignored or dismissed, we run the risk of not only adding another tragic number to the statistics, but the veteran is not a number. The veteran is someone who's fallen through the cracks regardless of the good intentions. Today's conversation should primarily revolve around the root cause of veteran suicide, identifying those at risk for suicide, recognizing the unique barriers that certain veteran populations face, and tying all of that to advancing and innovative approaches that the promise of preventing suicide among veterans. I'm eager to hear about the efficiency of recent improvements to VA's eligibility rules for mental health care. Under the Trump administration, VA will now expand mental health services to all departing service members for 12 months following the separation from the military, which, as we know, is also the highest risk period for suicide among veterans. And thanks to the works of this committee, veterans with other than honorable discharges may now seek mental health services for conditions that possibly contributed to their unfavorable separation status. Have these changes made a difference? I hope that today's hearing will shed light on this very challenging subject. We have the expertise, we have the support of the President. We can and must reduce suicide among veterans, and there's no excuse not to. I will now yield to Ranking Member Walz for any opening statement that he may have.